Hello, I'm Bernard Dan. I'm the Editor-in-Chief of Developmental Medicine and Child Neurology, and I'm joined by colleagues for an editor's podcast, which will be about motor performance and correlates of mental health in children who are deaf or hard of hearing, by Dr. Fellinger and colleagues from Vienna. Hello, Dr. Fellinger.
Hi, my name is Matthäus Fellinger. I am from Vienna, and I was part of the team deducting the study motor performance and correlates of mental health in children who are deaf and hard of hearing in Linz, together at the health center for the deaf at the hospital of St. John. Currently, I'm a junior doctor at the Department of Social Psychiatry in Vienna.
Welcome. And we're also here with Dr. McPhillips.
Hello, my name is Martin McPhillips, and I work at Queen's University in Belfast in the School of Psychology, and I'm particularly interested in development of children with particular focus on the impact of motor problems on the wider psychological health of the child.
Thank you. Welcome. So, Dr. Fellinger, we're going to talk about your paper. Can you summarize it in a few words?
I'll try my best. Thank you. I just shortly want to summarize for you the study we conducted. The study's name is Motor Performance and Correlates of Mental Health in Children who are Deaf and Hard of Hearing. This special publication is a part of a bigger representative study. It's called the CHEER study that was done in Linz at about 93 pupils. We can say that altogether, maybe we invited all children within 2 school years of the reach of Upper Austria, that is containing about 1.4 million people, and of all 86 that had been invited, we could examine 93 pupils, which had a mean age of 11 years.
That's a very impressive approach, and why are you confident that it is representative?
We are confident that it's representative because all those who had been now examined in the study, the 93 children, they do not differ according to age, according to nonverbal intelligence, and the other measurements we had to those who didn't participate or those we couldn't include in the study. So it seems to be representative for the whole population of Upper Austria, which means for the 154,000 pupils.
Mm-hmm. And what were your major findings?
Our major findings was that for the first time we could show in a representative study that in all 4 motor scales we measured, we used the ZNA for this, children with hearing impairment had far lower motor performance scores. They were at least 1.4 Z scores lower, but ranging up to 2.6 scores. Moreover, we could see that there's a strong correlation to peer relationship problems, and that static balance was correlated to the degree, that the level of static balance was correlated to the degree of hearing impairment. Yeah.
Mm-hmm. Dr. McPhillips, you have a long-standing interest in this. How do these results compare with your experience?
First of all, I found the sampling very impressive because, as far as I'm aware, this would be the first time that such a sample has been drawn from a large population. So I think that this was the first thing that was very impressive about the study, because normally I work off very small clinical groups. So this was a large population study. The findings were very similar to what we found. I think nearly 60%, I think 57% of the children in Matthew's study had very significant motor issues. In other words, they were scoring in the bottom 5% of a standardized motor test. We found around 50% in a sort of similar study. Our samples were drawn from a large population sample. It was a clinical sample study. So the correspondence was very close in terms of the actual extent of motor difficulty. And basically, it looks like more than half of children who are deaf or with hearing difficulties, with significant hearing difficulties, have very significant motor issues.
Mm-hmm. What about the relationship between the hearing impairment and the motor disturbances?
What is interesting that in our paper there is actually only a correlation to the static balance, which might be the most stable, most organic measurement of motor performance. In all the other areas, there's actually no correlation can be found to the degree of hearing impairment.
So you found a correlation between the static balance and the degree of hearing impairment, which sort of corresponds, I guess, with the traditional vestibular deficit theory.
Mm-hmm.
Can you tell us more about this theory, Dr. McPhillips?
This is the kind of probably the dominant idea within this area, that a child has hearing difficulty and at risk of damage to the cochlea or the cochlear nerve, that there's, if you like, a sort of knock-on damage to the vestibular main rear. So you're getting, in a sense, a kind of knock-on effect into the vestibular system. So
that would apply, but that would not apply to the whole population, I don't suppose.
No, I suppose the concern as well, as we move towards more and more cochlear implantation, is that the actual procedure, to what extent is there a risk of some sort of collateral damage to the vestibular? So it's kind of important to tease this apart. I think, although you didn't actually really examine this in regard to cochlear implantation, Matthäus, because you didn't have a big enough sample. Is that right?
We had 18 people with a cochlear implant, but the problem is that the implantation age is in our sample quite late. If I'm right, the average is about 4.5 years, and compared to up-to-date interventions, it's quite late. And we couldn't. So in our study, there was no correlation could be found.
Yeah.
One thing that I find intriguing, so you talking about this theory, you're talking about one way of testing this with a cochlear implantation, and Dr. Fellinger said that in his setting, such implantations occurs late. Do you think it's a developmental disorder, and so it would matter at which age, or we could, hypothesize that it would matter at which age implantation occurs, as to what sort of effect it would have on motor development?
Mm-hmm. I think this is a very exciting question. I think it's for sure motor, or in my opinion, motor performance and development is a developmental issue, but we do not really know what cochlear implant or in which way it's really changing the motor performance, because studies so far are quite ambivalent or not coherent regarding this issue. We see that there is an improvement in language ability for sure, but regarding motor performance, there are several studies who also show negative effects, especially also concerning more vestibular dysfunction. So we can't really draw a clear conclusion if there will be the same positive effect, even if with early interventions regarding to motor performance, for sure, for language performance.
Mm-hmm. Yes, I mean the research in our study, we actually didn't find a difference between the children without cochlear implants versus the children with cochlear implants in terms of static valence, which implied that
in terms of static valence.
Yes. We didn't actually find a difference between either children without cochlear implants or children with cochlear implants in terms of static balance, which suggests that the motor difficulties that the children were experiencing was more than that which could be accounted by vestibular deficit theory. So what may start off possibly, and it may be a contribution, certainly a contributing factor, potential damage to the vestibular system, the motor experience of the child seems to probably play a role as well, so that the child may start off with some sort of vestibular, possibly related damage, which impairs their motor development, which then impairs their ability to engage with other children through play and so on. And of course this is accentuated by the fact that they're also hard of hearing, which is impacting on their language and social engagement and so on. So their ability to engage with other children through play and through motor experience would also seem to play a part. So it's kind of going beyond kind of classic vestibular theory, so that the motor impairment may be related to the experience of the child. And this may be partly why we see this distinction between the low performance on the static tasks, or the different performance on the static tasks and the dynamic tasks, so that the dynamic tasks are particularly difficult for these children.
I think in this area we really would need longitudinal studies, because the way of causality we actually do not know yet. So maybe by improving language skills, because we see in our study the clear correlation to relationship problems in children, which factor, how the factor will be changed when children have also more ability to communicate, we actually do not know. So I think there are many questions still open, but for sure I underline what you were saying.
So the difference between static and dynamic balance may originate because of the experience of the child, and that this then impacts on the social experience of the child, which then impacts, if you like, on the more mental health aspect. And so you're setting off this chain of events where the motor difficulty becomes, I think in your paper you highlight the environmental stress hypothesis, where that the motor difficulty itself is an environmental stressor, which then puts the child at risk of more social issues.
Well, that's a complex suggestion, going all the way from hearing and perhaps vestibular influences to motor problems, to social problems, to psychological problems.
Yep.
How do we test that?
Well, that's actually very, very difficult. I guess the association really comes from other literature looking at hearing children who have motor problems, and research has shown that they are at marked risk of actually developing mental health issues, both internalizing and externalizing disorders. So there is, if you like, an already existing literature on motor difficulty and the increased risk of mental health issues. So therefore, that connection seems reasonable, that children who are deaf having high risk of motor issue, therefore that places them at quite a high risk of mental health issues. Now, the debate about where that motor difficulty comes from, in terms of whether it's totally a vestibular deficit, or whether it may partly be vestibular and partly through the social experience of the child, that is very difficult to unpick, and as Matthäus says, it will require some longitudinal work to really kind of work out which parts of that puzzle are contributing, and it may be that it's a different picture for each child.
Can we further add to the complexity? Do you think that at this stage there's some evidence pointing at the possibility that instead of a functional relationship between these aspects, as you've underlined, different factors like genetic factors might result in hearing problems and motor problems and social and psychological problems in parallel rather than in a sequence?
Yeah. I think that it's very likely that this is a very complex issue where there may be multiple factors which play a role. So it's probable that there are a number of children who are in trouble, if you like, even before they're born. And this may be related to genetic issues, and maybe related to problems during the pregnancy, etc., or even problems around low birth weight, prematurity. And all of these factors, as we know, are kind of risk factors for neurological difficulties. And I guess if we view hearing difficulty, deafness, part of that spectrum of neurological issue, we may be we would then be looking at some possible substrates that are actually problematic for these children. And then, of course, when they begin life in the world, their social experiences is either going to possibly help to reduce or accentuate those problems.
Would you like to add anything to this, Dr. Fellinger?
I just can say that for many children we examined, we actually didn't know. You never can 100% know what is behind. Is it a more genetic cause or not? It was basically told by the parents, and this was a very small proportion of parents, so where we could figure out that there could be a genetic cause behind. It is also interesting to know that about 90% of children are born to hearing parents, and also this is a big factor if you regard the social development of a child, that actually your parents hear and speak a language you can't understand, and as we know that as early intervention as possible, as a bigger increase or benefit it has. The first months, the first years are often not well used because also of these problems. So on the one hand, also in our study, we do not quite 100% know which neurological deficits or genetic deficits are also behind the hearing impairment. To some extent we know, but only by very few. And the second part is that the social complexity also for children with hearing impairment who grow up is a huge one in the development.
Mm-hmm. I suppose the reason why I'm suggesting that there may be risk factors in terms of development, very early development, even in prenatal development, is because in the samples that we have used, in the clinical samples, we find that there are more children, say for example from disadvantaged backgrounds, who are falling into the deaf category than children from advantaged backgrounds, which suggests that there may be some prenatal factors in the same way as there are more children from disadvantaged backgrounds who are born premature, born low birth weight and so on. So in a sense, the social kind of background of the child may place the child at risk of a range of neurological issues. And then the other point, of course, is that with all of the various developmental disorders and so on, you have this very high level of comorbidity or co-occurrence, which suggests that it's not necessarily one specific factor that's actually at the source or at the root of a particular difficulty. You're getting these huge overlapping issues, which may kind of point towards some sort of more common denominator in terms of neurological function or whatever.
Okay, so not only does this stress the need for prospective studies, but also for even larger groups because of all the heterogeneity that you both recognize. Now, I have a probably more difficult question, because you have these theories that become clearer thanks to the accumulated data. So you have good questions for the future. But the current questions that I would like you to address now is, what are the messages for clinical practice based on existing findings? Do we know about, do we have hints towards secondary prevention strategies that we should develop from now on, even before we get the results from the prospective studies that you want?
I mean,
so aspects that we should look at more systematically in children with hearing impairment.
For us, this study and finding these clear correlations was also to some extent astonishing, especially also seeing these intensive motor performance problems. We did know about it, but not that they are so prominent. And at the Institute for Senses and Neurology in Linz, at the Hospital of St. John, there is already a big intervention program, especially concerning language. And the first results show very clearly that the very early intervention, especially with the parents and trying to support them in the way they communicate, really has a big output or a big effect on the development of a child. This study for us clearly highlights the importance of also measuring motor performance in children who are deaf or have a hearing impairment, and also look to a broader extent on as well on the social performance, psychological performance, the motor performance, but also as concepts say, also the self-perceived competence that might play a mediating role in this. So for us, what we really would be keen on is to try to work and see if we can screen children immediately also regarding the motor performance and self-perceived competence regarding their motor performance next to language and psychosocial skills, and try to have early interventions in this regard. Which ideas do you have, Martin?
Well, I agree with you. I think that, of course, naturally, the most obvious focus is on the language development of the child, because, of course, deafness is going to have a huge impact on their language development. I think that what your work has done has highlighted another dimension to these children, another dimension, maybe having, certainly it's adding to the potential negative impact on their social development, and really to make intervention a more holistic, a more all-encompassing sort of approach. It would be important to first of all, test children on their motor scores as early as possible, and to intervene as early as possible. And it may be specific types of motor intervention that work better for these children. It may not be just simply that any motor intervention. It may need very specific motor interventions.
Mm-hmm.
Martin, you're working already with motor interventions for a longer period. We do not do this, but do you have special thoughts about which interventions are the most effective?
Oh, that's a good question. I think in terms of motor intervention, it may be that we need interventions that allow the children to experience more play-based activities, but we also may have, because they are down the line in their development, and this has had an impact on their neurological functioning and potentially even at a structural level, we may need specific activities, specific movements that actually address some of those underlying issues. So it may not be enough to have the children simply play or engage in activities that maybe a younger child or maybe the activities they missed out on as a younger child. It may require more than this, and this is certainly a challenge for the future.
Mm-hmm. And I have one more question, which is also a big challenge, is bringing back language into the picture. So do we need to consider the relationship between motor control, social interaction, psychological aspects, and language in our approach towards management?
I think this is a very relevant question if you talk about people who are deaf or hard of hearing, because we know that there's a big proportion that still uses sign language, and if we think that sign language is actually a very motorical language, there's for sure a close correlation that shouldn't be undermined. So I'm totally with you that as broader we can paint a picture, and as a more holistical view we have, as a clearer picture we actually get what is really behind and how we can influence it to a positive.
Mm-hmm. Okay, yes. Well, thank you. Well, I think we can call it to an end now, knowing that it remains an open question. Mm-hmm. I think this conversation has been very, very useful, and we've actually gone further than the paper and the commentary to the paper, and I would like to thank you both very much for this.
No, thank you, Bernard, for organising this, and thank you to Matthäus. It's good to talk to you. It's a privilege to talk to you both.
Yeah, thank you so much.
Thank you, both of you, and bye-bye now.